Dr. Justine from the Justine Blaney Wellness Center, and today I've got amazing, exciting information to share with you. These are the tools to help you with your spinal health. The same way your dentist gives you a toothbrush and flossing so that you need the dentist less often. You don't get those cavities. Well, the same thing here. As a chiropractor, we want to give you the tools in order to be able to help you perform your best and hold your adjustments, hold your spinal alignment. So in the spine, we should have a C curve in the neck. That's your brainstem. That affects your eyes, your ears, your sinuses, your blood pressure. That affects moods and sleep and your thyroid and down your arms. This is an area that gets super stressed over time and is aggravated with our head forward or with the purse forward or with driving forward. Whereas the mid-back might affect your digestion, your heart, your lungs, your breathing, things like asthma. Whereas the lower back might affect more things like your bladder, your colon, fertility, menses, or the power, strength, and energy balance into your legs. So we want to be able to maintain that C curve in your neck and the C curve in your lower back with making sure that our ear is over our shoulders and over our hips. So we might start with some of the stretches where we stretch forward, we stretch to the side, all right? We stretch forward and turn our chin to one side, turn our chin to the other side, and our shoulder rolls, even stretching the front of our neck. These are in some of our other videos, so I went through those more quickly. But many times we don't strengthen our neck. And one of the ways to strengthen your neck is with a head weight, which we sell. But we also do what's called an isometric contraction. An isometric contraction is when you hold that contraction without moving. And this can be done anywhere at no cost. So we want to strengthen that neck so that if you were playing sports, especially contact sports, or if you were ever to get in a car accident or fall, your neck would be strong enough to be able to hold your head. We also want to especially strengthen the back of your neck so that your head is not dropping forward and you're able to maintain this C curve better. So let's start with going to the side. You're going to push to the side for about 5 to 10 seconds and resist. And again, you're going to push to the side for 5 to 10 seconds, keeping your nose in line with your sternum, the middle of your spine. Now you're going to rotate, so I'm going to try and turn my head, but I'm going to resist. And again, I'm going to try and turn my head, but I'm going to resist. And you'll see these muscles engage. Now we're going to strengthen the back, so I'm going to push back, but hold steady. So push, 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 push. Push, 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 pushing towards the back, but resisting, strengthening the back of my neck. And finally, we're going to strengthen the front of our neck, which you would need to do a lot less often because we spend a lot more time looking down, but that would be pushing forward and then relax. So the concept of an isometric is a contraction and relaxation without moving the actual joints. You're keeping the neck in a steady position. There's some amazing other tools to help with your spinal alignment. One of them are cervical rolls. With Maximized Living, we have cervical rolls. We used to have wedges. We've now moved on to something a little more comfortable, and with the research, allows you to maintain that cervical curve. So the roll is something you lay on here so that way you can maintain your cervical curve. Similarly with the lower back to help maintain that cervical curve. So you would lay on your back with a pillow under your knees to help keep that alignment. So these would be like your retainer. When I had braces, I would wear my retainer at night and able to help me hold that position. After having braces, I have wires that you can't see. This would be similar to that. It's things that you can do at night when you're watching TV, when you're on your iPad or on your iPhone, you're reading, you can do these rolls in bed. And as you get better, from 5 minutes to 15 minutes, you can eventually even sleep on them and literally be creating spinal health while you're asleep. Another tool that we use for the neck is a cervical traction unit. It can be done standing, and we have different positions based on the curve in your neck. So you might have a C curve, a loss of curves, a reversal of a curve, an S curve, or a kyphotic S. So depending on the damage that's in your neck, we will be teaching you a standing CT pull, that's what it's called, standing CT pull, cervical thoracic CT pull, and we're going to be teaching you the different positions, the techniques, and how often to be doing it and how long to be holding it. This can also be done as a two-way tractioning, so it has an area for the door so that you can hang it from the door and traction your neck using your body weight. So similar to a traction table or an inversion table, this allows you to control that tractioning. So much compression is happening on our body. Our heads are so heavy, and especially if it's forward, it puts about anywhere between 40 to 60 pounds of pressure on your neck, and this helps relieve that pressure. It also helps to restore that cervical lordosis, that cervical curve, that brainstem curve back. We have lots, I know we're talking about the neck, but so important for your lower back. So if we find that a hip is uneven, we can use the wedges either laying on your stomach like this or laying on your back to help. So we might ask you to put the wedges in different positions depending on if you have one hip higher or the other. Our kinesiologists, our exam tech team are amazing, and they will help customize where you can put the wedges. So again, you could be doing healing to help your spinal alignment while you're at home and while you're resting. How do you know if your hips are uneven? Look in the mirror. Do you see one belt is higher than the other? Do you see a pant level unevening? If it's in your shoulders, you will often see that one sleeve hangs lower than the other, or you prefer your purse or bag on one side compared to the other. In the pants, often it's because you like putting things in the same pocket all the time, and that lets us know if your hips are uneven. And lastly, we have something called a wobble cushion. I use this to put in my back when I'm long drives or long car rides or long traveling bus or train. But it can be used, a wobble cushion, to help rehydrate the discs in your lower back. So our kinesiologists teach you how to mobilize those discs in your lower back in order to get better, hydration to your lumbar discs. This even helps with the cerebral spinal fluid, pumping that fluid through your spinal cord all the way up to your brain. So they've used this with children, in fact, and starting to do the amazing research on seeing how it helps with focus and concentration. So we have numerous cervical, lumbar, and even mid-back rehab tools to show you how to use in order to be able to maximize your posture and be able to do more things at home. Contact us at the Justine Blaney Wellness Center, and we would be happy to do a consultation with you to find out the right rehab for you. Our goal with this rehab is to teach you how to do it, and then you're able to do it on your own at home. Very similar to the dentist teaching you how to brush, and then you can do it on your own at home. We think that's amazing. We're so happy you shared this time with us. We'd love to get to know you and talk to you about the spinal rehab that you too can use to improve your overall health, because your nervous system controls everything in your body. Stay tuned with all our wellness talks, and we look forward to being a part of your healthcare team.